The World Health Organization and the CDC both recommend that if you've had COVID, you should be vaccinated for two simple reasons. Number one, immunity under a COVID infection doesn't last forever, and in some cases, doesn't even last 6 months. There have been studies to show that the antibodies, depending on how or when you got infected, might not last that long. That's the first reason. The second are variants. Also, depending on when you were infected, when they take people's blood who have been infected and they take their antibodies and try to test them against the variants, sometimes it doesn't work, which means that even a previously infected person could still be susceptible to what we would call a second infection or a reinfection. And we have seen now tens of thousands of those cases around the world. So we do know that having COVID once does not protect you, especially as these variants are cropping up around the world. What we know is that vaccinations, especially the 3 that are available in the United States, provide robust immunity through what we call polyclonal antibody formation. So a simpler way of saying that is that these vaccines actually make your body produce antibodies that can attach to lots of different receptors on that spike protein that we all kind of recognize from the coronavirus. That is important because as new variants that we don't even know about crop up, being able to have antibodies that can attack those spike proteins on a new variant is incredibly valuable and keeping us safe, not just as an individual, but as a society as well. There are some initial studies which show that if you've had a COVID-19 infection, that the first of a 2-series shot gets you the same level of immunity as someone who has not been infected and gets both doses. So that means that potentially in countries that do not have enough supply, a one-shot strategy, if you've already had COVID, could be appropriate. That is not the case for the United States, where we have enough doses and actually have more than enough doses for every single American today that needs a vaccine. So the CDC is following the FDA. The other reason that we recommend sticking to the dosing regimen is because that's what's been studied. This is still a vaccine where we want to not only build on the clinical trial data, but the real world experience. And all of that has been with 2 doses, if it's a 2-dose series, or the 1 dose if it's Johnson & Johnson. But it's critically important to match what we know from the clinical trials, because that gives us our best effort at being safe and effective against the coronavirus. So it's very important for people who have had COVID-19 of any form to get the COVID-19 vaccine shots. 1, it protects them as individuals from getting reinfected or infected with a new variant, which we know can happen. But 2, it also helps us as a society get closer to that population or herd level immunity where we just don't have any cases or as close to 0 as possible. Even if you're infected, you getting a vaccine doesn't just help you, it helps the people around you as well.